was a baby, so I've only heard the stories, but do you remember how painful an ear infection can be?
I just know it is tough on the parents and the kids when the problem strikes. It's actually one of the most common reasons that parents bring their kids into the doctor. Most kids have at least one middle ear infection by the age of 2. So we asked our pediatrician, Dr. Gigi Chawla from Children's Hospitals and Clinics in Minnesota, to share some advice with us this morning. Good morning, Dr. Gigi.
Good morning. Thanks for having me again.
This is the worst for parents because so much, you can see the pain on those kids' face.
Yes, absolutely.
All right, is there anything you can do to prevent it?
Ooh, thanks for asking. Yes, lots of great things. First, really good hand washing, right? Because most of the time an ear infection starts with acquiring an illness first.
Okay.
Second would be avoiding cigarette smoke. So
cigarette smoke is a big one.
It causes enough inflammation in the mucous membranes that will lead to trapping of mucus and be the setup for an ear infection.
Interesting.
The third is making sure that you breastfeed your babies because just all of that great immunity can prevent ear infections. And then the fourth is get your immunizations. So those pneumococcal vaccines can prevent about 20% of ear infections.
You hear these from new parents, and we were just talking to Matt Brickman a little while ago. His baby was experiencing this. What happens if you kind of have that ear infection that keeps coming back?
Yeah. So, there's some pretty strict criteria around how many ear infections is too many. So absolutely we expect kids to have a few here or there because they're setups. They get colds often. They put their hands in their mouth and can easily acquire an infection.
This is middle ear usually is where it's happening?
Yes, behind the eardrum, right? But when you're seeing ear infections that are 3 and 6 months, 4 and 6 months, or fluid that persists behind the eardrum for 6 months, then next steps should be considered.
Would that be the tubes in the ears that you would talk to your doctor about?
Yeah, you should talk with your physician about whether or not ear tubes or tympanostomy tubes would be an option to help treat ear infections. They don't necessarily prevent them, but they help treat them.
How long do infants usually have to keep those in when they have a tube?
Yeah, so most of those ear tubes can last between 6 months and 18 months or so, just long enough for them to get over, their frequent illnesses that they're exposed to.
I think there can be some worry if you do have a baby that this keeps coming back. I know I was one of them. Is there any long-term effects that could come from this?
Yeah, well, the reason that we all get excited about ear infections isn't just about the pain or the fever or, the heartache that comes along with having an ear infection. It's about making sure that we preserve kids' hearing and making sure that they're hearing well enough to learn and lay down language at such an important age. So those would be the effects that we're really worried about.
And when you see the signs, it's the fever, and the crying.
Yeah, and sometimes kids will display things like when they're laying back or reclining, it's really, then they have a lot of pain then also, or difficulty swallowing or something like that.
Well, we hope for all parents and all children the best and not get those ear infections.
Exactly.
Thanks, Dr. Gigi.
Thank you. Thanks for having me.